enhancement there.
You're listening to Head South Radio with your host, Kat Meyer, a podcast dedicated to prioritizing pleasure and removing the stigma and shame around sex. We're here to be curious and have an open conversation about sexual health and relational wellness. This podcast is intended for educational and entertainment purposes. The information discussed is not a substitute for professional medical advice.
Okay, so Maria, to get started, we're just going to settle into our seat, and you can start to close your eyes or just soften your gaze, allowing your vision to be watery, whether the eyes are closed or open. Allowing your eyes to just settle into the sockets. And then start to feel your seat, where you're making contact, the foundation of your body, rooting down into the ground. And from that rooted experience, like a tree, grow a little bit taller through the crown of your head to allow some lengthening in the spine, starting to integrate the spine to create some integrity, and then pull your shoulders closer towards one another, and then allow the shoulders to drape down your back like a cape, creating space across your collarbones, a lengthening of your neck while you're rooting down into your seat and drawing upwards towards the ceiling. Relax your jaw. Let your elbows become heavy, hands resting wherever they are. Let the tongue settle in the bed of the mouth. Find some space in your jaw. Release any expression across your face. Tune into your breath. Just taking a moment to observe the quality of your breath in this moment without the need to judge or criticize or even effort here. Just taking a moment to witness the breath. Taking a moment to set an intention for our conversation, how you want to feel, how you want to be, what you would like to receive, any intention that calls to you for the next hour. And then when you're ready, just start to blink your eyes open, taking in the light, taking in your space, taking in the screen. Thank you for joining me, Dr. Maria.
Thank you so much for having me.
We'll get started post little meditation drop-in with some icebreakers. So I'd love to know what your sun, moon, and rising are.
Ooh, I love this question. Okay, I am a Virgo sun, Gemini rising, and an Aries moon.
Ooh, do you identify as a Virgo?
Okay. So this is actually a very funny question. If you look at my chart, it has a lot of Leo placements, and I wasn't very well familiar with astrology. And so like kind of just knowing the gist of it, I was kind of like, oh, like big, bold, brash, like that's a Leo. So I'm a Leo. And I had read something that the like, I think sometime in 2000, like they changed the zodiac calendar. So I technically then fell into Leo because I was on the cusp. I don't think it actually sustained. And my roommate was a Leo, and she was like, no, I'm a Leo, you are not. And so, but I kept saying, no, I'm a Leo. And then I got a formal chart reading like a year ago. Yeah, about a year ago. And I learned all this stuff. And I realized that actually the most Virgo part of me is deciding that I'm not a Virgo. So yes, in theory, so the answer is yes, I'm 100% a Virgo. Even though turns out my personality is actually really just Aries moon, and like my big fight is my Aries moon. But in my family of origin, if you know, that's where my house of Virgo is, and in my family of origin, I'm very much a Virgo. I'm a type A plus person there because people don't tend to do the things that they need to do, and so I have to come in and step in. And in my own personal life, I tend to be a type A minus person because I can be a control freak, and it's something that I learned how to let go of things. And so if I need to let go of things, I just can't care about it at all. And so my friends are like, "You're so brilliant, and yet you don't even know where you parked your car." And I was like, "Yeah, at some point I'll find it."
Yeah. I also think it's a little Gemini. It's a
Yeah.
little bit of Gemini
Yeah.
coming through. Your Gemini rising coming through.
Yeah.
Oh, I love that. I too have a lot of Leo in my chart.
Mhm.
I am a Cancer cusp Leo, but then there's like 4 or 5 placements in Leo. I have an Aries moon as well.
Yes.
And so I only, like, also recently, like within the past like 5 or 6 years, got my birth chart read similar to you.
Mhm.
And as much as I identify as Cancer, my astrologer was like, you have to embrace this Leo part of you. There's so much Leo, and you can lessen the grip that the Cancerian part of you has, the introverted, the, more observing, nurturing part of you, and be more outward, vibrant, expressive, if
Yeah.
you will, as a Leo. And so I always post right at the cusp, because my birthday is the cusp of Cancer to Leo, right in the transition to Leo season. I always post this photo of a little kitten that has the lion's mane.
Oh, I love that.
And I'm always like, that's what I want to embody. That's who I want to be,
Yeah.
is like the kitten of a Cancer, but the vibrancy of a Leo with my little mane.
I
So
love it. I absolutely love that. And you actually give very much Cancer energy. I'm not quite sure what that is, but my best friend growing up was a Cancer. And
Mhm.
to me, what it embodies is just this kind, warm gentleness. And every time someone tells me they're a Cancer, I'm like, you know what? I see that. You remind me of my
Yeah.
friend. So I love that.
Oh, thank you. I appreciate that. I was at a trade show last week, and it was funny. I was there with my brother, and we would interact with people. And after like a few moments, this is the first time it's ever happened, where multiple, I would say at least 5 people were like, "Are you a Pisces or a Cancer? Are you a water sign?" Like they kept trying to guess what I was. They're like, "I can tell you're like a Cancer or something." And I
Yeah.
was like, I've never had that happen, where people like tune into it and like really pick up
Yeah. You have a
on my
very
sign.
grounded,
Yeah.
kind persona about you.
Oh, thank you. I appreciate that. But back to you. What do you hate to ask for but love to receive?
Okay, that is the first question of sex, or first answer of sex, but that is not really, that doesn't even fully make sense, but that's the urologist in me. Let's see. So what do I hate to ask for but love to receive? Oh, I hate asking for help, but love receiving thoughtfulness and help. And so that is something that I've been working towards. Like I said, I'm that Virgo in my family, so I had to learn real quick how to figure things out at a very early age. When you immigrate to this country, your parents are a little busy, and so you got to figure things out on your own. And so because of that, I became hyper independent to a pathologic point. And so my work in therapy has been learning how to ask for help and learning how to be open. And so, so it's still not something I love doing, but it's something I'm getting better at. And I love receiving people helping. It's just it's a nice feeling when your friends just show up and like, we're here to help. No questions asked.
Yeah. It's funny. I'm going through the same thing. Are you an oldest daughter?
I am the only daughter of a family of 4 kids. And so
Okay. Yeah.
not a lot of strong female influences in my life outside of myself. And so, I've got very much older daughter tendencies.
Yeah. We have a melted family of like, my older siblings have a different mother, but my mother raised them. But I am like sometimes oldest child, but I do have that kind of tendency to like the fixer, the planner, the organizer. But my other siblings do as well. We all have different roles, which I love. I feel very blessed to have so many siblings, because we each take on a different role of support. And I've witnessed friends who are only children who don't have that with their, like, especially with parents aging,
Mm-hmm.
that processing of like, oh, having to like manage it all. And I'm like, I feel like my family has like a little like C-suite of
Oh, I love
people
that.
working and supporting my parents. And so I love that. But I definitely have a very like producer, getting things done,
Yeah.
organized tendency. And
Yeah.
I know that that came from a young age, and like trying to, maybe it's like coming from a big family and like corralling the cats and like getting everybody in line. Would you rather have sex to the same song every day or never have sex with music on?
I would rather have sex with the same song every day.
Oh.
100%. Yeah.
Mm. What is the song?
Oh, I can't think of anything off the top of my head. Something, I mean, obviously something slow. What if I was like Sandstorm? No. Something slow, probably something like Giveon. Anything by him I just love, and it just always gets you in the mood.
Mm-hmm. Moody movie.
Yeah. And Sandstorm, of course.
Would you rather be blindfolded or blindfold your partner?
I would rather be blindfolded.
Oh, cool.
Yeah, it makes you more present in the moment.
Mm. Mm-hmm. Like that sensory deprivation and
Yeah.
then utilizing other. And then who do you call first when you have great news?
Ooh. Who do I call first when I have great news? It all kind of depends on what the news is, but my oldest brother, or I have a council of like really amazing physician women, and so I'll share things with them, or I'll share things with my oldest brother. But yeah.
Mm-hmm. I love that. So, Dr. Maria, if you wouldn't mind introducing yourself, telling us who you are, what you do, who you work with.
Hello, everyone. My name is Dr. Uloko. I'm a board-certified urologist that specializes in comprehensive sexual health, which means that I take care of the medical and surgical management of sexual dysfunction in all genders. There are 7 of me in the world. Most people think that urologists do men's health, which we do. So we do anything with erectile dysfunction, Peyronie's disease, any low libido, low testosterone, and that's very much ingrained in our curriculum and how we train. And then the flip side, everyone also thinks that gynecology does the exact same thing for women, but the field of gynecology in people with vulvas and birthing people, but really the field of gynecology really focuses more on birthing and cancer. And so anything in between that falls within the realm of quote unquote women's health or vulvar health is just really not well addressed in that field. And so my goal and my research and my advocacy is closing the gaps in care and closing the gaps in access to care for all genders, all people.
Yeah, and I just want to go back to it because you like very quickly skimmed over it. There's 7 of you in the world.
Yeah.
What does that mean? There's 7 people in your specialty. That is so rare and so special. So can you speak to that a little bit more?
Yeah, it's honestly, it's such an interesting thing because when I chose my fellowship, actually people told me like that's not what we do. It was it was a very confused thing. And so I'm one of 7 fellowship trained to do this work. And so we realized though that like that's not enough people. it's like kind of, I think the statistic is 3 billion vulvas in the world over the age of 18 that need care, and 100% of vulvas in their lifetime will need care outside of birthing babies and cancer. And so how do you then account for that? And so we do a lot of the 7 of us that have been fellowship trained have trained other physicians to learn this work. We do a lot of advocacy and patient advocacy as well. And I even built a health tech company around this very issue because there's a huge workforce shortage in women's health in general. And then also of the providers that are there, they are not being taught about vulvar health and female sexuality and female sexual health. And because of that, people are suffering. And it's just it's not just sex. Sex is very important, but it's things like chronic pelvic pain, it's recurrent urinary tract infections, recurrent vaginal infections, overactive bladder symptoms. Like, these are just very common things that people kind of just suffer with. And the medical system is not doing a really good job. And the reason it's not doing a good job is because it's essentially creating a workforce that doesn't learn anything about women's bodies outside of birthing and cancer. And a little, like, maybe, and then when your organs prolapse out of your body. But that's it. And so, yeah, if you've ever been to a gynecologist or your doctor and been like, that felt wrong, you're correct.
Yeah. That's so interesting. And I love that you distinguish, because I understand that now. Like, the gynecological practice is more around reproductive health.
Mm-hmm.
Like, if I think about my exams, it's always about cancer, reproductive health, STIs,
Yep.
disease
Yep.
related.
Yep. Yeah. Not quality of life centered at all.
Mm-hmm.
Yeah. It's something in men's health. In urology, we very much value quality of life, and we center it in every decision making that we have. And fortunately, in women's health, just if you look historically, that has just not been the case. It's very much a "did you die though" mentality. And instead of like "did you die," I want us to change the question is, how are we helping you live? That is what I want for the entire field of medicine. And this is going to take wide sweeping reform, because our medical education system, our training systems, they are not centered and focused on that question.
A very simple question, but something I think we could need to kind of establish. Vulva, vagina.
Yeah.
What's the difference?
Yeah.
Let's start there. And then I do have a lot more questions about the disparities in healthcare and actually what your vision is for the future of healthcare that you just touched on. But let's just go back to the very beginning of vulva, vagina, because it's something that is so commonly misunderstood, considering this country, people in this country have sex education, but they're like, something's been amiss, something's lacking here, because a lot of people can't distinguish, even within their own bodies, what that anatomy is. So if you wouldn't mind giving us a little brief sex ed,
absolutely,
anatomy ed.
It's my absolute favorite thing. It's just so it just speaks to our poor sexual health education, and I think it's just egregious that we can't find access to about our own bodies. Like, we can't find information about our bodies. It's not wide sweeping. It's all kind of hidden underneath the rug. So I love doing this. I love talking about it, getting down to the basics. So I have a vulva above me. My apartment's covered in genitals, and so genital art. But yeah, so the vulva essentially means external genitalia, and it's kind of almost it's a complex. It's everything that you see on the outside, and there's some debate about the semantics of it. Why doesn't each part be taught and labeled very separately, and we just kind of lump it up into the term of the vulva? But I digress. So the things that the vulva has are the top part, which is the mons pubis. It has the labia majora, which is the outer lips, and then it has the labia minora, which is the inner lips. It has the vestibule. It has the hole that you pee out of, called the urethra. It has and then has the perineum. And then what everyone thinks is the vagina is actually the vulva, the vestibule in particular. But the vestibule literally means entrance to the temple. So if you're watching porn, or if you're ever looking at your vulva and actually spread apart the lips, what people think is the vagina is actually the vestibule. It was actually a really important part of the body that no one knows about, and is like a center of my research. And then the actual inner canal is the vagina. So the vagina you can't see. It's nowhere. You can see the opening into the vagina, but you cannot see the actual vagina on the outside without needing a tool like a speculum.
Thank you for that little education. Do you think, this just popped in my mind when you said that, do you think the vagina monologues kind of Like that was a big thing when I was, I think in the 90s, like, and you would hear about, do you think that like helped misguide people? Because people were speaking about it as, and I think they were referring to their vulvas a lot of the time in those monologues, right? I was like,
I think it speaks to the kind of the dismissal of, you know, quote unquote female genitals, right?
Yes.
You know, we don't, for the penis, there's very much penis, scrotum, balls. Like everyone knows the three parts. They're not like looking at the penis and being like, oh, that's the scrotum. You know, it's like, we're very much attuned to the different parts of that anatomy. But and that's even in pop culture. And like, so that has not only translated scientifically, it's also translated into pop culture references, right? Like we all know what a penis looks like. We were all to close our eyes. We could picture it, but we don't, for the most part, know what a vulva looks like. We don't. A lot of people don't even know what their own vulvas look like. And so I think even just the way that we talk about the vulva, I hold my company Vulva AI because I needed people to start saying the word vulva and realizing that it's not the vagina. And I want to bring, and I love this question because I think there is just, I want to bring a level of objectivity to women's health that just hasn't been there, right? We're just kind of like, oh, it's the vagina. I'm like, that's literally like, as a surgeon, you can't just be like, I don't know, that's where it might be the liver. And it's like, no, why can we not? It's an organ of reverence. It's an organ that does so much. And it's just, as a scientist, we need to be doing better about calling the parts the actual parts. And it starts with education on the forefront. And then hopefully as we become more educated, you know, media gets better, right? Like just even the fact that we can't even use the word vagina on media and social media, it's just such a highly censored organ. And because of that censorship, it then worsens kind of the lack of objectivity and like the lack of seriousness around the organ. So it starts with education. I think that's really where it starts, is like, how do we fight back? Is like we first start educating ourselves about our own bodies.
Thank you for that. So when someone's thinking about vulva healthcare, what is that? Like, what are we considering here in that?
It's honestly like low-key something I made up. And I don't mean that in a way of like, I mean it because I'm a researcher in this. And so we talk a lot about our vaginal health care. We talk a lot about our skin health care. We talk about our dental routine, our gut health, our heart health. But no one actually ever talks about our vulvar health. And it's so important. And I didn't know that. I think that's also why I'm so vocal about a lot of this work, is because it wasn't until I started medical school at 15. It wasn't until the very last year of my training. So, no, I started med school at 17. Last year of my training at like 29, 14 years in, I was like, I started learning the actual names of the vulva. I started learning how they work, what happens when you keep them healthy, how to keep it healthy. Like, did you know that if you take care of your vulva and get it the right nutrients and all the things, you can have the same vulva at 20 at 100 years old? There is absolute magic in the vulva. The secret to life is in the vulva. I that as soon as I like fix all these advocacy things, my next third or fifth research project is actually looking at, and I'm saying this out loud because I need, and if anyone's a scientist that wants to collaborate, I'm all about collaboration. But the regenerative properties of the vulva is one of the most fascinating things. I've had, you know, one of the things I talk about in vulvar health is prevention. So the vulva is a super hormonally sensitive structure. Without hormones, it cannot stay healthy. And what does healthy vulva looks like? It literally, when you go through puberty and you have healthy hormones, and not just estrogen, testosterone is a very important hormone in all people. Your ovaries actually make about 10 times more testosterone than it does estrogen. So when your ovaries start producing hormones, these sex hormones in puberty, your vulva actually starts to open up and change and grow like a flower, hence all the flowery imaging. And when it loses its hormones, it literally starts to wilt and die, and the skin changes, it becomes thinner, it becomes more painful, the pH changes, the flora changes, it's more prone to infections. And if you don't actually have an infection, all of those skin changes and inflammation now feel like you constantly have an infection. And literally, little old ladies, little old people with vulvas that haven't had appropriate vulvar healthcare, which is most people because most doctors aren't taught this, their vulvas shrink and everything literally closes up and they're miserable and sad and getting infections and pain. Sex is painful, and these people actually can die from these things. The UTIs. Not the painful sex, but the UTI. Actually, people can die from painful sex because it's totally destroys your mental health. And we have absolutely lost patients in our community from mental health struggles related to their pelvic pain. And that's just that's really sad to me, because a lot of what we see is preventable and is treatable, but because the healthcare system is not doing what it should be doing for patients, the only people that are suffering are patients. And, the fascinating thing is that there are medications for this. There's also research for this. I'm not the first person to ever write or talk about this. It's just that I get to compare and combine and do the work. Because if we actually truly took care of the vulva, and even the vulvas that have closed shut, if you get on low-dose vaginal hormones, your vulva will open right back up. Again, that flower analogy. You just got to keep your garden healthy. And if we were teaching young people with vulvas about, what is going to happen to your vulva throughout the lifespan, we could be saving so much disease, so much suffering, so much unneeded healthcare costs, and so much death too around these issues. And so, yeah, it's just one of those things where it's just like, it's so easy, but how do you then disseminate this big concept to all of medicine? And all to every single person that has a vulva, so they know what to look for, so they know what to advocate for. So that's what vulvar health is. It's actually knowing your vulva, knowing what the signs and symptoms are of an unhealthy vulva, and we kind of talked about it can present as several things, and then knowing how to keep it healthy, which is just low-dose vaginal hormones when you're in menopause or you're on something that is changing your hormones. So understanding that hormones and your vulva go hand in hand together. If you're on anything that changes your hormones, you're potentially changing your vulva, whether for the better or for the worse. And if you're on birth control and you're like, oh, it's crazy, I'm getting all these yeast infections now, or I keep getting UTIs, or I keep not having painful sex, maybe it's the hormones. It's just like these little things that we could be having such deeper, richer conversations, more nuanced conversations. And I feel like we have to start with the bare minimum, the bare basics. Your vulva is a garden. You need hormones for the rest of your life in some capacity, because humans just weren't living as long. And so now that we're living as long, how do we take care of our bodies? And that's, again, not how do we help you live? I want to change that narrative in women's health.
I love that. How do we help you live versus dealing with illness. I just posted this actually on Instagram of if you don't take care of your wellness, you're going to be dealing with illness.
Ooh, I love that. I absolutely love that. I will.
Yep.
Ooh.
Steal that. Take that.
Absolutely.
Let's take a quick break. Are you tired of the hormonal roller coaster that comes with birth control pills? 11 years ago, I decided to ditch hormonal birth control and embark on a journey to find a more natural alternative. Over the years, I've used condoms, calendar tracking methods, and withdrawal, which can sometimes be pretty risky and stress-inducing practices. However, I've discovered a game changer, Natural Cycles. It's an FDA-cleared birth control app that has brought me peace of mind like never before. Whether you're planning or preventing pregnancy, Natural Cycles has got your back. Let's talk about numbers for a moment, even though I hate numbers. Natural Cycles is 98% effective when used properly. And here's the best part. You're not putting any extra hormones into your body. It's all about understanding your cycle and making informed decisions. Ready to start your hormone-free birth control journey? Use the link in our episode description to get 15% off the annual subscription for Natural Cycles. That's right, 15% off to take charge of your reproductive health in a natural and effective way. Say goodbye to those hormonal ups and downs and hello to a birth control approach that aligns with your body.
Not all lubes are created the same. Here at Head South, we've worked diligently to pare down the ingredients so there is no fuss and no unnecessary bits and bobs. Head South intimacy serums make it simple and easy for you to reduce friction and enhance pleasure. Listeners can get 20% off their first order of a starter kit using the code PODCAT24. That's PODCAT24. And now, back to the episode.
So my next question is, so what is like a practice in which someone can care for their vulva? So like vulva hygiene, vulva care, what is your take on wipes or steaming or any of these kind of practices?
Yeah, I think it's actually, it's a very nuanced question because there are really great products out there that are great for the vulva. I think this like overarching is the vulva is skin. So much like skin, it's going to need some products. It's going to need moisturizer. It's going to need all these things. And then the hard part is, in capitalism, a lot of the products marketed to women aren't actually safe.
Yeah.
So it's like, and then now, and this is what I love about, tech and being able to meet other female founders, is that they always have a story that's so powerful. It's always like, I was getting chronically ill from the products I was using, and I decided to create a safer product. Like, I'm just like, yeah, hell yeah.
Yep.
So there are a lot of great things out there, and finding what works for your body is very, very important. I think one of the biggest things that I would always endorse is looking at your vulva. Learn to do vulvar checks. So when you are, like, for men, we have testicular cancer. We know that, men from young men to like around 50, 60 should be checking their testicles. Always check your testicles. We always tell them that. Every month, check your testicles. I'm trying to do the same thing for the vulva. Start looking at your vulva. It literally changes month to month. And you have changes going in and out and all the things. Like, for my people listening, if you have periods, if you notice right before your period, your vaginal tissue, your vagina, vulva feels more sensitive. So just clock that. You might not clock it now, but you're going to clock it next month, I promise. Those are hormonal fluctuations. That's all, like, that's the beauty of the vulva. It literally changes week to week, day to day, minute to minute. And if you don't look and start noticing these trends and all these things, you're going to start going to your doctor and being like, oh my gosh, I have a UTI. When in actuality, you just have vulvar irritation because of it's right before your period. And so then your doctor just gives you antibiotics, and now you needed antibiotics, or you got antibiotics, took antibiotics when you never needed it. But if you were just more in tune with how your body responds on a monthly cycle and how that affects your vulva, that's where it's at. And so many people will come to me, they've had decades of pain, pelvic pain, and they're like, no one believes me, blah, 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 all the things, like the horrible, sad stories that I've heard are made worse when we do an exam. And the way that I do my exams is I actually teach my patients how to do a vulvar exam. So you have a mirror, or we have a special camera called a colposcope, and you're actually doing the exam with me. I rarely ever use a speculum because I'm not looking at your cervix. A lot of the times your pain is not caused by your vagina. A lot of, like, the vagina doesn't work that way. If you're having pain with penetration, it's not your vagina. It's the entrance to your vagina. And because most doctors don't even know that entrance has a name, that it has specific properties, they don't know. But the thing is, you can actually see when it's not healthy. So I'll have patients that have tell me the saddest stories. They've been suffering for decades. We do an exam that takes 5 minutes. no speculum, no pain. And they get to literally see that their vestibule is red, raw, and inflamed. And that is the explanation for their symptoms. And like the heartbreak that I got to witness so many times over, that this person was passed around the healthcare system suffering for years. And all they had to do was just look down and be like, yeah, that's not, like, every single patient always like, holy fuck, that's red. I'm like, yeah, you're not crazy. None of the things that you have been saying were wrong. Just the healthcare system didn't know what to look for. I even have patients send over a patient to me, or like doctors send patients to me and say, yeah, I'm sending you a new patient. They have pelvic pain. I can't figure it out. I did an exam. And I'm like, oh, great. What did you find on your exam? And they're like, I don't know. It was just really red. So I didn't know what to make of it. I was like, that's literally the issue.
Yeah.
But so like, unfortunately, these are real conversations that I have with really amazing physicians. It's just that we're literally, when we see those changes, we are not taught to say, that's bad. We can fix that. That means it's such a disconnect. It's like having a blatantly red penis and everyone's like, I don't know why your penis hurts. And like everyone would know, right? Like, and this is the difference between people with penises and people with vulvas. You can see a penis. You can always see a penis. For the most part, there's something called a buried penis, but you can see a penis. It's easy to examine. Versus a lot of people, the vulva isn't easy to examine always, but you can. There are ways. Just get in front of a mirror, show yourself your vulva, and get down there and take a look, and you will be surprised what you see. So, and if you need instructions, sign up for Vulva AI. That is why I literally made this company, because we have such poor resources for people to even learn this information.
Thank you for that. I honestly feel like you just told me my story, because that was something I dealt with in my 30s, early 30s. And I had been going from gynecologist to gynecologist. They were all male, older, and white. And I was really frustrated because I kept swinging back and forth between BV, yeast infections, endometriosis, like, and not being heard, and being like, I don't, like, this is not right. And they kept putting me on antibiotics, and I would have these crazy symptoms, and I'd be like, I feel uncomfortable. And then I finally found my gynecologist in New York, Dr. Antoinette. She's been on the podcast. And when I spoke to her, she's a part of this healthcare team that kind of inspired this podcast, was like connecting and realizing how much of a privilege it was to find her, my primary care physician, my Chinese medicine practitioner, as well as Dr. Antoinette sent me to a dermatologist for an issue I was dealing with, because doctors kept sending me back and forth between, like, saying it was the itching, let's say the symptom was itching, BV, yeast infection, and they just kept putting me on antibiotics. And I found Dr. Antoinette, and she was like, you need to go to this dermatologist in Soho. I can't recall her name. And it was just an incredible experience of, like, who would have thought that it was vulva care, and it was a skin-based thing. It was not my vagina. It was not a yeast infection. It was not a BV. And the doctors just kept putting me on. And it was my body responding to the antibiotics that was creating the symptom of itchiness. And it was I have goosebumps, because I had years of dealing with this, and then going through periods of, like, feeling uncomfortable about my body and not wanting to have sex, and like my mental health was affected so greatly because of the frustration of the healthcare system, and going from doctor to doctor and not being heard. And then Dr. Antoinette was the first doctor to be like, hold up, I hear you. We're not putting you on antibiotics. We're going to send you to my colleague, who's an extremely incredible dermatologist, and it resolved it. And it was just a matter of some ointment and skincare. For down there. So
that's the thing. It's just so, your story is just the story of so many people, and this can't be the case, because 100% of people with a vulva in their lifetime, because it's the things that are inevitable. If you live long enough, menopause is inevitable. And with menopause, because it's a loss of hormones, that's also going to change your vulva. And these symptoms you can prevent. And also you can treat if they, like, let's say you didn't get a vulvar specialist beforehand. You can treat. So easy, so simple. Just someone knows what to look for, and then how to treat it. And they, instead of having like a really lovely experience like you had finally with the dermatologist, it's that back and forth. It's that navigating a system that doesn't give two shits to learn about your body. Like it makes me it makes me so angry to hear these stories, because that shouldn't be on the individual to have to navigate basic anatomy and physiology. Like, these are the foundations of medical training and education. And for the most part, most doctors are leaving without that training. And that is literally leading to patients having this exact story. And we're actually collecting. So one of the beauties about building this company is the community that we're building around it, and our already work with several organizations around people either suffering recurrent UTIs, chronic pelvic pain, is capturing these stories, because I think these stories are so powerful. For me, they've been transformative and have fueled a lot of things, but a lot of healthcare people don't hear it. They don't see it. I got to hear it about 2,000 times when I had my clinical practice in San Diego. And like, it was just an overwhelming amount of patients with the same story. And I was just like, this is unreal. This is so sad. And this actually means that there is a much larger problem and we need to go fix it. So yeah, that's what we're doing now.
Yeah, so tell me about that. I would love to hear more about Vulva AI.
Yeah.
And what you're doing there, and what that offers to people. Especially, I believe one of your biggest advocacies is working with people in marginalized spaces who don't get access to this kind of healthcare, or who get chronically dismissed within the healthcare system.
Yeah.
So how does that combine forces of like your passion for helping marginalized communities and bringing in tech to help support sexual health?
Yeah, so it's actually so interesting. And it's such a fascinating thing. I have always been a patient advocate, like straight out the gate, right out the gate. I ran a free health clinic in med school, and it's just always something that I'm super, super passionate about. And it's funny because, and this is going to be an inflammatory statement, and I'm going to say it, but there's a caveat, asterisk. Women's health is a disparity group, period. Like, that's just in general, women's health in comparison to men's health, and these are the big quotes around this, it's disparity medicine to me, just in general, wide sweeping in comparison to men and women. Women's health is disparity. And so it is, and then, like, if you think about it, and this is a perfect example, is that menopause, which is not cancer, but quality of life, most physicians are leaving training without any sort of menopause care, even though menopause affects every system in the body. And that is even seen that even people with the most access and privilege cannot get the right care. So Oprah Winfrey, who is the most well-resourced person probably that we all know or know of, was having heart palpitations. And we know that with the loss of estrogen, it can change your heart structure and lead to heart disease down the road. And Oprah has the best cardiologist because it's Oprah's heart. So it's a little bit more special, right? And so like, and I'm kidding, everyone's exactly the same specialty in my book, but there is, this is the world we live in. And so Oprah went to her cardiologist like, hey, I'm having heart palpitations. She got this full formal workup. They couldn't find anything, yada, yada, yada. Still having heart palpitations. So scary. What's going on? Turns out it was menopause related. She had to go to several doctors before she even got to someone that was like, hey, you're menopausal. Maybe it's your hormones, right? Like, that's where we're at. Like, Halle Berry went to her gynecologist. Again, it's Halle Berry. She went to her gynecologist, or primary care provider, a doctor, and said, hey, I'm having symptoms of GSM, which is genitourinary syndrome of menopause, which is caused by low hormones, which is associated with menopause, and how very famously in menopause. That doctor thought she had herpes instead of it is well documented that when a menopausal woman coming in with lower urinary symptoms, pain, all these things, think GSM. It's just so straightforward. But these are the narratives, right? This is what's happening to the ultra rich, ultra wealthy, ultra connected. So in general, all women's health is just disparities. And then if we start adding on intersectionalities, oh baby, they're not getting anything. Why do you think Black women are dying at 5 times higher rate in the United States from childbirth? It has we always want to blame the individual, but it's the system. And the system is not good. And the training isn't good. We need to have significant training and education reform around women's health that actually includes the entirety of a woman, not just birth and cancer. And so that is why I love this work, is because I get to do that disparities work, that research, that advocacy for all people. But really, I center in if we look in women's health right now, menopause is having a moment, all these things. There are not a lot of Black women still in that space. And I am going to make sure, if we are having a women's health revolution, I'm going to make sure Black women are at the table, and I'm going to make sure that every person is at the table, because as the intersectional feminist, everyone needs to be at the table. This is not just a table of wealthy white women making decisions for everyone. I really am claiming my space so that we have everyone at the table. And I know my voice is not the only voice. And that's why actually I come to tables and I make sure that I invite everyone else.
Yeah, you're a champion as well.
That is my
elevating other voices as well.
Oh my gosh, I can only speak on my experience, and my experience is very unique to me and my culture and my cultural background, but I cannot speak on anyone else's cultural background. And so I make sure that I center those voices, and it's really fun to build a company around that. And so this is Vulva AI. What that looks like is we're a company that is helping using predictive AI to help people with vulvas that are suffering from recurrent urinary tract infections, recurrent vaginal infections, chronic pelvic pain, overactive bladder symptoms, and also female sexual dysfunction, get cheaper, faster, more accurate diagnosis. We have a option to go directly to consumers and also directly to healthcare systems. And what I wanted to do was fix the problem that doctors aren't being trained. Patients don't have places to find resources to even learn about their bodies. And oftentimes, if you're someone experiencing symptoms that no one can figure out, you have to then become your own healthcare advocate. And these people are some of the most diligent, brilliant humans. They will fight. They will do all the things, but they don't have resources to fight. They don't know what the workup is for hormonally mediated vestibulodynia or pelvic floor dysfunction. They don't know, but if they could, they would absolutely be advocating for that. And so I wanted to be able to create kind of a primer for people as they're experiencing these symptoms. What can I also be asking my doctor? What are some other things that it could be? Because doctors only learn about this much when they really need to know way more. And so we fill in that gap where doctors are failing, and where the healthcare system is failing. So if you have a hospital that's partnering with us, we are actually directly teaching the gynecologists in real time how to start diagnosing these patients. And then let's say that your hospital doesn't partner with us yet because women's health is undervalued, unfortunately. The patient shouldn't be the one to suffer. You still have the ability to log in, create your account, take the quiz. The quiz gives you what we call like a predictive model. Like, hey, based off of what you told us, it could be all these different things. Now let's teach you about what all these different things are. Now that you know, now let's teach you about how to diagnose these things and then what the recommended treatments are. And then also we're going to teach you how to talk to your doctor, and we're also going to teach you how to create your own health summary so that now when you go into the doctor, you are so armed. You are so ready to advocate for yourself. I am a staunch advocate. I am not afraid to be labeled a bitch or difficult or these things in for other people. For myself, I'm still working at that, but that is what I'm good at. But the thing is, I can't be in everyone's doctor's visit for them. But I can create something that can be, and it can help you advocate, and it also provides support and symptom tracking. Like, my goal is to stop these stats. 7 years to get a diagnosis. 80 million women, 80 million people with vulvas in the United States are suffering either from a myriad of the symptoms I talked about. 7 years to get a diagnosis. 3 doctors or more to get that first diagnosis. And then 35% of these people will see up to 15 doctors or more to get a diagnosis. And it's just like, why can I diagnose you in 30 minutes when you've spent 20 years trying to find someone just to even believe you? Like, there's no difference in me other than that 1-year fellowship where I actually learned about the vulva. And then there's actually really complex things, but for the most part, and I'm being very simplistic, because then when I start talking to people, I can see their heads, eyes glaze over, but I am being very simplistic because I do need people to understand that this is easy and straightforward. If you just give it the time and attention that it deserves. And if we are truly a healthcare system that says that we care about people, then let's fucking care about people. And let's make sure that they are getting the right diagnosis. And we're not just going off of vibes. We have to bring actual facts to women's health and not just feelings. And that is just something I just am such a believer in, because these things are affecting people that look like me more than any one other demographic of people. And to know that a lot of this can be prevented and easily treated, and know how vulnerable people feel in a healthcare system, I really felt it was, that phrase of, with great power comes great responsibility. And so I didn't build the system, but do I have notes for the system? Fuck yes. And and I will let them know my notes. That's the Virgo in me.
I love that. I appreciate so much, because I think, and this is just from a patient perspective, something that I recognized and realized in that whole frustrating journey. And it was years of that experience of not being heard, not being validated, dismissed, is that once I found the right doctor, so Dr. Antoinette, when I told her, I also expressed to her, I don't want to be on antibiotics. I also want to work holistically with my naturopath, my Chinese medicine practitioner, my primary care physician. And her eyes lit up in excitement of oh, there's a network here, instead of being dismissive. And so when you find the right doctor who wants to prevent things with you, and also who gets excited by, my primary care physician, I remember she used to get so excited, Dr. Patel, whenever I'd come to see her, because I'd have the latest thing I've just discovered or something I've tried for myself. And then she's used that information to refer to other patients. So when I found that dermatologist, she started referring her patients to that dermatologist. So when you find a doctor that really, like yourself, really wants to help and advocate for patients, as a patient, you don't have to worry oh, I don't want to be annoying. There's the people pleasers out there. I know you're listening, because I'm a people pleaser, and I know that it's hard to be I don't want to be I'm just going to listen to the doctor. I have authority complex. I'm not going to speak out. Speak out, and also know that what you're feeling, what you're sensing is totally valid. And there are doctors like Dr. Maria, Dr. Antoinette, Dr. Patel, who are there to listen and who want to work with you and also want to learn from you.
Yeah.
Like it's not a an ego thing to be like, hey, I just saw this thing, you might be interested, or I just tried this thing and it's working for me. Like doctors who really care and like care as a part of their practice care about what's working for their patients.
Yeah.
I believe.
Yeah, no, I love all of those things. I just really echo patients, like, it is okay to be considered and labeled a bitch. It is okay to be considered and labeled mean. It actually means that, you actually, like, that's not, I personally, if someone's like, I yeah, it's okay. It's like, I just really want you to know it's okay, because what happens oftentimes is that, I do think a lot of physicians go into this with such good hearts and intentions. It's just our training is so poor, and the way that we are trained is, you come in as like this young kid, 20 something for most people, and you think, well, obviously medical training and education is as up to date as possible, so everything I could possibly need to know, I'm going to learn in these next 4 years, because I'm paying them a lot of money. So I'm assuming I'm learning everything I need to know. But a lot of them are leaving training without, only 50% of medical schools even require sexual health training. And then most of that is male sexual health or female sexual health. So a lot of the trainees, the medical students, are leaving not even knowing about the vulva, and then going into training programs that are, again, also dismissing these things. So when you are meeting that doctor and you're telling them, hey, by the way, I have these symptoms that don't really make sense, or I have these symptoms that fit into the traditional categories of UTI, yeast infection, but they're not a UTI or yeast infection. Your doctor is like, well, that's all I got in my toolbox, right? And it's more so a lack of information in their toolbox, a lack of tools
within the system
in their toolbox. Yeah. And so what we're trying to do is we're trying to give doctors that toolbox, because they were, unfortunately, did not get it formally. And so that is what we're trying to do, is provide more tools in their toolbox, because those couple of symptoms can be so many other things. And so, and then this is, I'm trying to explain the psychology of gaslighting. For the most part, it's like, for doctors, they're like, well, if it's not those two things, I don't know anything else, so they must be crazy. And there's actually a lot of like Freudian weaves in how doctors and paternalism is essentially, we tell you how to feel about your body. Like it's like deeply ingrained in our training, and especially in gynecology, it's a very paternal, it still has a very paternalistic attitudes around, again, because you never really want centered quality of life. So a lot of times that their training is, I make decisions for your body instead of I make decisions with you. And that's just a culture thing. And, these are things that are really hard for people to unlearn. And so, when someone's presenting with those symptoms and there's nothing left in their toolbox, their immediate first reaction is to be like, well, it must be you, not me. And so I explained all of that to let the patient know. And if you're a patient in the doctor's office, that's most likely what's happening in their head. And then they go about their day. They're like, well, another patient satisfied, because they're doing so many other things, right? So they're probably not thinking about that person with recurrent BV. And they're like, I hope it works, because that's all I got in my toolbox. But if you then, as the patient, demand, like, no, this is unacceptable, that actually gets them to start paying attention and to start noticing. And I wanted to be able to provide resources for patients and resources for physicians to make that. So yes, absolutely, always never be afraid to be labeled hard or difficult, because it's, no matter what, that doctor is going about to their next patient, and you have to go back to your life that you can't even sit, or you can't even have sex, or you can't even all the things. So always, always, always speak up. It is never an issue. And if your doctor says that is an issue, that is not the doctor for you. And so, yeah, that's the thing. Unfortunately, the issue lies deeply in our medical education system. And how do you then combat a system that is training really well-meaning doctors, but they don't even know that the system isn't training them well? And I say this as that was my story. And so, you know, when I was like, wait, how did we just not learn any of this? And so it's just wild to me. Now, once you see it, you can't unsee it. But yes, I love patient advocacy. Speak up, say all the things, be loud, be vocal, but respectfully, obviously.
So Dr. Maria, to close it out, how do people find you? Where do they look for you? And you also have a podcast yourself.
Yeah.
So how do they get more from you?
Yeah. So if you want to follow along in our Vulva AI journey, we are on social media, vulvaai.co, and it's vulva, VULA, and then I.co. We're on Instagram, we're on TikTok. We are also join the waiting list. So that's really, really important. If you want to be one of our first users, you want to know when we're launching, or if you just want to support and love the mission and love the vision, sign up for the waiting list, share widely. Those numbers really make a difference in terms of funding. In order to build a company, in order to change women's healthcare, we need funding. And so if anyone is well-resourced, connected, do those things. If anyone is in LA and wants to work with me, I also have a private practice where I see all genders, couples of all variations for sexual health. And so it is very, very fun. I take a very holistic approach to sex and sexuality. I like to combine East and Western practices. And I just like being science and sex and merging the two. And then if you want to follow me on Instagram, I'm on Maria Uloko MD, and then I'm also on Twitter. So yeah, I'm doing a lot. And then I also have a podcast about the intersection of tech, women's health, and sexuality. And so that's called Salvaging Sex, and Kat was a guest on there as one of our amazing founders that we also highlighted.
Thank you. And thank you for being a guest on my podcast. I really appreciate it. I'm really glad that we got connected through our mutual friend, Hannah, a personal fave. And yeah, and it happened while I was on a hike with Hannah. She mentioned you, and then you messaged me in that same moment. And so it was kind of like a serendipitous, synchronistic moment of connecting. But we love Hannah.
We love Hannah. Dare I say she is our personal fave.
Yes, truly.
That's the brand of our company.
Yes. Yeah. Dr. Maria, thank you again so much for being a guest. And that's all.
Amazing. Thank you.
Special thanks to all of our guests. Head South is hosted by Kat Meyer, produced by Isis Barlow, edited by Megan Hook, with music by Lily Rezi Rothman, graphics by Ella Chodos Irvine, cover art by Gina Ship Casey, and intro by Murph Meyer.
If you're looking for me